India today spoke to Dr. Angelique Coetzee, the South African doctor who first identified the Omicron variant. Now, Dr. Coetzee said that the majority of the Omicron cases in South Africa are more prominent in those who are unvaccinated. She said that there are reinfections despite the vaccine, but symptoms are extremely mild. Now, Dr. Coetzee also pushed for booster doses, particularly for vulnerable groups. She suggested that India should start giving a booster dose to healthcare workers, followed by those with weak immunity and then other high-risk groups.
Cases are mild. I spoke with my group of doctors this afternoon. I also asked them, listen, what are you guys seeing? Is it still mild cases? And then they said exactly the same. Yes, there's a higher transmissibility, or it's quite fast spreading, but the cases are mild. We're not seeing severe ill disease patients. Ever the younger patients coming in will complain of a sore throat. They have a bit different symptoms than the 20 pluses, so they will have the sore throat predominantly, and they might have a fever, they might have a slight elevated pulse, but and they might, look ill, acute ill, but I promise you, then the majority of them, within about 3 to 4 days later, you will not believe that that was the same child that you have seen. So that the recovery rate is very good as well. We had 73,911 people tested, and 19,800 was positive. So we've got a lot of people going to test. It's nice. It's a 19,000. But do we see all those sick people coming into the surgeries, overflow the surgeries? No, not really. We can handle. This is not the same at primary healthcare level than Delta. Delta is a dangerous virus. None of the general practitioners in Gauteng that we are aware of have put anyone on oxygen. We're not aware of, I know of 2 or 3 patients that has been admitted earlier, but there's already been this discharge. So mild symptoms in the end, it's just a scare because it was before we knew that it is also mild. At hospital level, that is a different picture, but at primary healthcare, where the majority of patients are being seen, it's mild.
Has South Africa started with it? Do you think we need it? Specifically with India, as the double dose vaccinations are currently on, do you suggest a booster jab also for the population?
I suggest that, especially your vulnerable groups, your 50 pluses, people vaccinated more than 3 months ago, that because that's what we see.